If you want to quit smoking, it can be overwhelming on where to begin. And the reality is you might need a little bit of help, whether it's vaping or smoking cigarettes. Estimates are that people that try to go out and just quit smoking on their own without any outside help, only about 5% of those people are successful. But the good news is with modern medicine, there are a few very effective FDA-approved therapies that can really help kick your addiction. So in this video, I'm going to go over 3 of these FDA-approved therapies, and I'm going to go over the pros and cons of each and how you can properly use them. Now, quick side note, the most effective way to quit smoking would be to combine one or more of these therapies with some sort of smoking counseling. So a lot of times, someone might need more than just a medication. And also, a lot of times, people need multiple intervention attempts to really quit smoking. So don't get discouraged if you already tried a different method and failed. The first product I want to talk about is nicotine replacement therapy, or NRT. Basically, as the name sounds, it replaces the nicotine that you get in your cigarettes or your vape with a different form of nicotine. And they can come in many different forms. So there's short-acting drugs like chewing gum, lozenges, inhalers, and nasal sprays, or long-acting drugs like nicotine patches. The goal is to gradually reduce your body's dependence on nicotine without actually smoking and getting those other harmful components. So these are all done in what's called a step-down approach, meaning the dosage is gradually reduced over a series of weeks. And usually this treatment will last between 7 and 12 weeks. Now, just like anything, there could be some potential side effects or adverse effects from nicotine replacement therapy. And these side effects are mainly from the actual nicotine, because you're still getting nicotine in your body. So some people might get cardiovascular side effects because nicotine is a vasoconstrictor. So this can increase your heart rate and your blood pressure. You could also get GI symptoms like nausea and vomiting, and it can also affect your central nervous system. And this can lead to headaches, dizziness, and nervousness. You can also get oral side effects, so this can lead to xerostomia or a dry mouth. It can also lead to mouth and throat pain. It can also lead to hoarseness in your voice. And another side effect is insomnia. Now, there are some people that absolutely should not use nicotine replacement therapies. These would be people that have any allergies or hypersensitivity to any of these formulations in these therapies, or people who have recently had a myocardial infarction or arrhythmias, or have severe or worsening angina. So if you're considering one of these therapies, it's really important to talk to your physician to make sure that it's okay for you. The next medication I want to talk about is Bupropion sustained release. Now, this drug used to go by the brand name Zyban, which got discontinued, but it also goes by the brand name Wellbutrin. Now, this drug is actually an antidepressant, but it also helps with smoking cessation. So this drug is a dopamine reuptake inhibitor, and it works by basically lowering the spikes that will reinforce smoking. So your dopamine will spike in the reward center of your brain in response to something that is pleasurable. And one of these things that spike dopamine is smoking. And this is how things can lead to addiction, because your brain will want to keep reinforcing that dopamine release. And these spikes are what cause people to continue to use nicotine and other substance abuse. Now, how Bupropion works is you get a little dopamine surge, but you don't get that huge spike from nicotine. So the goal is for people to gradually taper off nicotine, because it'll kind of dampen those dopamine spikes and also dampen your cravings. So people are usually on this drug for between 7 and 12 weeks. But the goal is for someone to quit smoking about 1 week after you initiate this therapy. Now, in general, with a drug like this, a patient really has their own option when to quit smoking, but ideally a patient would set their quit date 1 week after they initiate this treatment. Now, there are some contraindications to this drug as well. The biggest one is if you are at risk for seizures. Although it is rare, this drug can make you at a higher risk for getting a seizure. And there's also a lot of other drug interactions that can also increase seizure risk. So if you're already taking other medications, that even puts you at a higher risk. So really important, again, to talk to your physician and 1, see your health history, and 2, see if you're taking any other medications that could negatively combine with this drug. You also should not drink alcohol when you're taking Bupropion. And again, it comes down to seizures, because alcohol will lower your seizure threshold, meaning it will become easier to get a seizure when you're drinking alcohol. Now, in terms of other adverse effects, systematic reviews say that there is no serious cardiovascular issues from taking this drug. And also, some people say that Bupropion can increase anxiety, depression, and suicidal ideation. So how true is that? Well, again, systematic reviews say that there is no increase for adverse psychological effects in both people with or without a mental health disorder. The other cool thing about Bupropion is it can actually be combined with nicotine replacement therapy. For example, if someone feels like they're at a really high risk of wanting to smoke, you can actually combine a nicotine patch with this medication for better effects. Now, the third drug I want to talk about is Varenicline, or Chantix. Chantix is a selective alpha-4 beta-2 neuronal nicotinic acetylcholine receptor partial agonist. Now, what the heck does that mean? It means it works directly on nicotine receptors in the brain, and it inhibits the binding of nicotine to receptor sites in the central nervous system. So what this does is similar to Bupropion, it will block the reinforcement and reward effects that you get from dopamine. And it'll also hopefully over time decrease cravings and withdrawal symptoms. Same thing with Bupropion, the goal is to start 1 week before you want to quit. Now there are some side effects with this drug as well. Some oral side effects are actually very rare, but you could potentially get dry mouth or altered taste. You could also have other general side effects like irritability, abnormal dreams, including nightmares, also insomnia, nausea, headaches, and fatigue. Similar to Bupropion, there's no significant cardiovascular effects, but there could be potential depression and suicidal ideation. Now, a lot of these adverse effects can be rare, but it's definitely important to talk to your physician to see how at risk you are and if these medications are safe for you. Now, how effective are these drugs? Well, all forms of nicotine replacement therapy are proven to be effective. Now, if you had to choose which one is the best, well, studies show that Varenicline produces a greater cessation rate than any other type of nicotine replacement therapy, and also compared to Bupropion. Now, comparing just nicotine replacement therapy with Bupropion, after 6 months of using each medication, studies show that they are actually really similar in their results. But again, the best way to quit smoking would be some sort of combination. So combining a nicotine replacement therapy with another drug like Bupropion. You need to understand that tobacco dependence is actually a chronic disease. And again, like I said before, multiple quit attempts are actually pretty typical. And many adults who do try to quit smoking will also require some sort of smoking counseling in combined with one of these therapies. Counseling and medication together are by far the best way to quit smoking. Do you ever wish you had straighter teeth but hate the idea of those metal braces? Well, you might have heard of something called Invisalign or other clear aligners before. These are basically some things that can straighten your teeth without having those ugly metal brackets on them. So in this video, I'm going to talk exactly about what Invisalign and these clear aligners exactly are, and if